everyone. Thank you so much for being here. My name is Cornejo. As Savannah mentioned, I am a fourth year PhD student at UC Santa Barbara from the Department of Communication. And today I'm going to be talking to you about a project that I worked on during the fellowship that explores Latinos, undocumented immigrants coping with the COVID-19 pandemic. But before I get to this project, I want to talk a little bit about myself and why this research matters to me. So I immigrated into the United States from Mexico when I was around 6 years old. And right from the start, I began to notice how my parents, as new immigrants, faced various barriers because of their immigration status. I fortunately didn't experience these stressors or barriers until I was about 16 years old when I was applying to college, employment, and so on. And that's when my status really became a barrier. Fortunately, though, I had great teachers, advisors, and mentors who guided me through college and gave me various tools to succeed and increase my own social mobility, and as well as contribute to my own immigrant community. One of these tools was research, where I had the opportunity to learn how research can be used to really help give back to immigrant communities. So, and that followed from my undergraduate schooling up until now. And so now that you know a little bit about me, I want to transition and talk about undocumented immigrants in general in the United States. So as many of you know, undocumented immigrants are disproportionately disadvantaged in the United States. They live in constant fear of deportation for themselves and for their family members due to their immigration status. Because of their status, they are not able to qualify for federal assistance. This includes employment benefits and SNAP or food stamps because of their status. However, contrary to what some media says about undocumented immigrants do contribute to US economy. So for example, in 2015, undocumented immigrants paid $23.6 billion in federal income taxes, which is money that they can't use because of their immigration status. Nevertheless, although they do contribute to the United States economy, undocumented immigrants work in the healthcare, food, and agricultural industries, which are often unsafe and low paying, which places them in a higher risk for various setbacks and negative outcomes for their health, including COVID-19. So as you see on the screen, this is a chart from UCLA that looks at case rates of COVID-19 for different age groups as well as race and ethnicity. So for example, you can see that the Hispanic community is very much impacted negatively because of COVID-19. This chart, however, does not tell us how undocumented immigrants have been impacted by COVID, which is really the center focus of the study I worked on as part of the fellowship. So in the study, it was qualitative in nature, and the goal of it was to see how undocumented immigrants are being impacted, but also how, from their perspective, what can we do to help them navigate, this pandemic successfully and onward. So the study conducted 30 interviews with undocumented college students, as well as 50 interviews with undocumented non-college students. And for the purpose of the presentation, I'm going to focus on three research questions that we explored in this study. So the stressors that undocumented immigrants experience because of COVID-19, the type of resources that undocumented immigrants use during COVID-19, as well as the resources that they need to lessen their stressors during COVID-19. So from now on, I'm going to be focusing on the non-undocumented college sample of undocumented immigrants living in the United States. And these are some of the preliminary findings. So 89.7% of our participants were from Mexico, and 74.5% of them were women. When asked about their mental health during the last 30 days, 61.5% of our participants said that they had fair or poor mental health, and 63.2% said that they experienced fair or poor physical health during the last 30 days. With regards to sources of stress, a thematic analysis on the interviews revealed that undocumented immigrants face stress because of food insecurity. So for example, 56.4% of our participants said that they had difficulty paying for food when they needed it, as well as inability to pay for rent as well. As you can see on the screen, this is a quote I took from one of our participants, and they said, similarly to pay rent, it's been difficult for me. I owe past rent, 1 month behind. Eating, I've also had to reduce it. So this gives us a glimpse of some of the stressors that undocumented immigrants are facing from their own words. In addition, 82.1% of our participants said that they had difficulty paying for rent or housing. With regards to employment, 64.1% said that they've lost their job due to COVID-19, which was another source of stress, as well as the inability to qualify for government assistance, which, as I mentioned in the beginning of my presentation, this is something that, because of their status, undocumented immigrants are unable to qualify. Finally, technological limitations also emerge as a source of stress for undocumented immigrants, particularly for those who have children. They shared that these knowledge or access in technology prevented them from helping their children with schoolwork. When asked about the resources they use to deal with COVID-19, overwhelmingly, participants mentioned that food dispensaries were a source that they used to deal with COVID-19. So this includes obtaining free food from either community food banks, churches, as well as the school's free lunch programs if they have children who go to school. This is a sample quote from one of our participants, and they said, the only resource that I've used is the food bank. I go once a week. Additionally, medical assistance programs, so for example, community health centers or free clinics, as well as the $500 from California Governor Newsom's program, were other resources that undocumented immigrants use to deal with the stressors that they're facing due to COVID-19. And unexpectedly to me, participants said that the $50 payment that they were receiving for participating in this study was a source of resource for them that was helping them during COVID-19. Again, this is something that I didn't expect, but it's something that our participants highlighted in the interviews. When asked about the resources that they need to better navigate the pandemic and onward, increasingly undocumented immigrants shared that they would like more information targeted to their own immigrant communities in their own immigrants, or in their own language, excuse me, as well as food assistance. This is a sample quote from one of our participants. She says, we can't live off of cans, which again speaks to some of the issues and barriers that they face when going for food at the free food banks. Additionally, undocumented immigrants shared that unemployment benefits and rent support will help them, navigate the pandemic as well as just live a better life in the future. This is a sample quote from one of our participants that I took, and they shared some sort of help to pay rent. That's the main thing. Finally, undocumented immigrants shared that they would like some cash assistance to help them deal with the pandemic and also help pay for their utilities, for example, cell phone bills. And this is something that's very much needed in the community. So now that I talked about the preliminary findings, I want to move and talk about what CARE can do to help undocumented communities. And I'm going to provide a first phase or short-term solution, as well as a second phase, more longer-term solution. So the first phase, which I would classify as short-term solutions, is creating and distributing information that is accessible to undocumented immigrants, providing cash assistance to support for basic needs, for example, rent and utilities, as well as engaging in food aid, particularly on culturally appropriate food, so food that undocumented immigrants are familiar with. This will help them, just have a better quality of life. And all of these things are things that that CARE is already doing overseas with some of the communities that they're working outside of the United States. So using some of those strategies that's already been implemented and successfully done elsewhere, and using it here in the United States would definitely help undocumented immigrants. The second phase are more longer-term solutions, and this includes helping undocumented immigrants have self-efficacy via educational programming. So for example, technological literacy, financial literacy, which again was highlighted by undocumented immigrants. And engaging in the second phase longer-term solutions will help undocumented immigrants have human dignity, as well as giving them the resources to engage in social mobility on their own terms. CARE, however, is not the only organization that can help undocumented immigrants. As individuals, we can help undocumented communities. So I've listed 3 things that we as individuals can do to help undocumented immigrants. So for example, informing yourselves on the resources that help undocumented immigrants, being an active ally and using your privilege to advocate for undocumented rights. At the beginning of the presentation, I mentioned how undocumented immigrants have this fear of deportation. So really using your privilege as a documented individual and speaking on some of the things that can help undocumented immigrants can definitely help our undocumented immigrant communities. Finally, donating to nonprofit organizations that can aid undocumented immigrants. So for example, the UndocuFund, which is based on Sonoma County, and the 805 UndocuFund, which provides monetary financial aid to undocumented immigrants in the Santa Maria, Santa Barbara area, can help undocumented communities. So this help can have various impacts to our immigrant community. So for example, creating resources can help undocumented immigrants have a better quality of life. And this also contributes to helping undocumented immigrants living their lives with dignity. And finally, although you might not think of this, or many of us might not think about this, helping undocumented immigrants and creating resources for them can indirectly help us, the general public. This is because undocumented immigrants have a crucial role in the workforce and economy. So by helping undocumented immigrants, we all benefit. So I want to close by talking about my future work. So in the fall, I'm going to continue creating and distributing brief reports on the study's findings, as well as beginning to work on a project relating to undocumented students' use of mental health services. And I'm going to continue to work on research and help and collaborate with organizations to help increase undocumented immigrants' access to information and resources. And lastly, I'd like to thank all of you for listening to my presentation, but also the CARE UC Initiative team for giving me the opportunity to participate in this fellowship, as well as my advisor, Dr. Jennifer Pam, and David Leach, who was my CARE advisor, and the COVID-19 team, Rosalia Mendez, Humberto Rico, Betsabe Lopez, and Alicia Velasquez, who conducted the interviews with undocumented immigrants, as well as all the RAs who were involved in this project. And of course, the participants who so gracefully shared their experiences with us. Thank you so much.